Welcome to Podocyte Talk, bringing you timely updates from the world of kidney research. In this episode, we begin with a study evaluating Finerenone, a non-steroidal mineralocorticoid receptor antagonist in patients with IgA nephropathy. While Finerenone has already demonstrated benefits in diabetic nephropathy, evidence in IgA nephropathy remains limited. This retrospective, multi-center cohort study examined 178 patients who were receiving standard supportive care. Patients were divided into two groups, one receiving only RAS inhibitors and the other receiving RAS inhibitors plus Finerenone. Over 6 months, the addition of Finerenone resulted in a significantly greater reduction in the protein-to-creatinine ratio compared to RAS blockade alone, achieving a 45% reduction versus 32%, respectively. A higher proportion of patients treated with Finerenone achieved low residual proteinuria levels below 0.3 grams per gram. Serum potassium levels increased modestly, but without instances of uncontrollable hyperkalemia, and blood pressure lowering was minimal and clinically manageable. Importantly, the eGFR decline was small and not statistically significant, and the incidence of adverse events was similar between groups. These findings suggest that adding Finerenone to RAS blockade may be an effective and safe strategy for proteinuria reduction in IgA nephropathy, supporting the need for future long-term renal outcome studies. We then moved to a study addressing acute kidney injury in very old patients, those aged 80 years and above. Although advanced age is recognized as a major risk factor for AKI, detailed data specifically in this population have been limited. This cohort study analyzed 2,132 hospitalized patients with a median age of 86 years to evaluate the incidence, severity, risk factors, and short-term outcomes of AKI. AKI was defined and staged using extended KDIGO criteria to include both community and hospital-acquired cases. Frailty was assessed based on a clinical frailty score of 5 or higher. The main outcomes were AKI incidence and staging, along with secondary outcomes of 30-day mortality and the composite endpoint MAKE30, which included death, new dialysis requirement, or a doubling of serum creatinine within 30 days. AKI was frequent, affecting more than 1/3 of patients, and was predominantly community-acquired. The risk of AKI increased with advancing age, reaching its peak among patients aged 95. While nearly half of the cases were mild, a significant proportion progressed to more severe stages. Frailty emerged as an important independent risk factor for AKI, and both AKI and frailty were strongly associated with higher 30-day mortality. Notably, among patients aged 90 and above, frailty had a greater impact on mortality than AKI itself. These findings highlight the serious consequences of AKI in the very old and the need for early identification and targeted strategies addressing frailty. Finally, we examine the relationship between SGLT2 inhibitor use and urinary tract infections, particularly in individuals with underlying genitourinary abnormalities. Although SGLT2 inhibitors have well-documented cardiovascular and renal benefits, their association with genitourinary infections remains an important concern. In a nationwide analysis comparing new users of SGLT2 inhibitors and GLP-1 receptor agonists, it was found that SGLT2 inhibitors were associated with a greater risk of candida-related UTIs, but a lower risk of non-candida UTIs. Patients with prior genitourinary abnormalities, such as a history of UTIs, genital infections, malignancies, or indwelling catheters, had an elevated risk of both candida and non-candida UTIs overall. However, the comparative risk for non-candida UTIs between SGLT2 inhibitors and GLP-1 receptor agonists remained stable across subgroups. In contrast, for candida infections, an additive risk was observed when SGLT2 inhibitors were used in individuals with underlying urogenital issues. These findings suggest that while SGLT2 inhibitors increase the risk of fungal infections, they do not increase bacterial urinary tract infections, even in patients with pre-existing genitourinary abnormalities, providing clearer guidance for patient selection and monitoring. Join us on Podocyte Talk as we continue to bring you the latest insights into kidney disease research and treatment. Check the description for links to the studies discussed in this episode and stay tuned for more insights into kidney disease research and clinical innovations. Tune in now to stay informed.